Hello, my name is Rae'Nyshea Miles, and this is my healthcare presentation on India. The history of India. Indians practice what is called Ayurvedic medicine, also called Ayurveda, is a traditional medicine utilizing the healing arts that balances the use of herbal remedies and medical practices. Many rural in urban poor areas rely on alternative treatments such as acupuncture or Unani medicine, according to Spector. Ayurvedic medicine is a 4,000-year-old method of healing. What I don't have in here is that it also paved the way for a lot of other medicine studies as far as Chinese and other cultures. It kind of created the path of medicine, surgery, and all the healing process. It was kind of like the foundation, I guess you could say. Onward, the structure. The Constitution of India considers the right to life to be the fundamental and obliges the government to ensure the right of health for all. To a significant extent, India's health sector has been shaped by its federal structure and the federal-state division of responsibilities and financing. The states are responsible for organizing and delivering health services to the residents. The central government is responsible for international health treaties, medical education, prevention of food adoration, quality control in drug manufacturing, national disease control, and family planning programs. There's a serious health provider shortage in India. 40% of the primary health centers are understaffed, according to WHO. India produces over 25,000 physicians annually in the modern system of medicine and more than 400 a year in Indian system of medicine and homeopathy. One of the problems with their structure, not necessarily the structure, India struggles with keeping the licensed nurses and physicians that they create. They license a ton of people. It's just that once they do get their license, they move to the US or they move to where they can prosper as far as making more money. So that's one of the dents in their structure. Their financing. According to Global Health System in India, it spends a total of 14.8 billion annually on healthcare. This equates to approximately 5.2% of its GDP. It's predicted that India will spend 33.6 billion in 2012, which accounts for 8.5% of the GPD. And India's healthcare system is India's healthcare system is that grossly inadequate and underfunded, according to WHO. Only 5 other countries in the world are worse off than India. Public health spending. Burundi, Myanmar, Pakistan, Sudan, and Cambodia. Despite relatively low overall spending on healthcare, state expenditures are even lower, only 0.9% of its GDP. Along with what I got from the book, I also did research with today's Prime Minister, which is Narendra Modi. He's trying to make changes. During the speech to mark his country's Independence Day on Wednesday of 2018, Modi said it's essential to ensure that we free the poor of the India from the clutches of poverty due to which they cannot afford health care. The Times of India reported. The National Health Protection Mission, also known as Modi Care, will give impoverished families health insurance coverage up to $7,100 every year. This may not seem like a lot by American standards, but in a country where the annual per capita income is just over $1,900, it will make a massive difference to those who cannot afford private treatment. So he is planning to make big changes. I didn't really find any research on how far it's come now. That was just the most recent I know plans that he put in play. Interventional. According to the Indian Institute of Medicine, private firms provide approximately 60% of all outpatient care in India and approximately 40% of inpatient care. Approximately 7% of the hospitals in India are private sector owned and operated. One of the most significant attempts to providing quality care interventions in India is the promotion of the use of primary health centers in delivery of care. However, these centers are understaffed, personnel are underpaid, and equipment and supplies are lacking. Approximately 1 million Indians die each year because of insufficient treatment, disabilities, and lack of personnel to meet the care demands of the country. The northern areas of India have the greatest health care needs, yet these areas tend to have the most difficult access challenges. Overall, India funding is where they lack in general. So they have to find. I feel like they have to find where they can get the funding. But with Modi Care in play, hopefully it'll make changes. Preventive. Prevention is the most serious challenge in India, partly because of the inadequate funding and disparity in regards to access, especially for the poor. Because health issues are inaccessible to large numbers of Indians, prevention is a major problem. Recently, Indian Health Organization, a subsidiary of Aetna Inc., U.S. launched preventative healthcare plans, a first of its kind preventative healthcare package in India. The plan was introduced with an endeavor to make the costly preventive care a bit more affordable to common men. IHO joined hands with 12,000 medical providers across 25 cities, building the nation's largest network of medical professionals. Mm. India number one online Policy Bazaar, India's number one online insurance portal has collaborated with IHO to make this plan available to its wide network of customers. So also with this launch, also with Modi Care, hopefully this puts India on a path to a better, healthy economy. There's so much that plays into why they can't really be preventative. The pollution in the air, the water that they drink, it all affects them all the time, and it's kind of hard to escape because of the poverty. they still live in it. Even though they might get help, it still doesn't stop from where they live. Resources. Family is a major human resource in India. Although every religion has its own unique characteristic and traditions, especially in relation to housing preference and lifestyles, there are many similarities. Despite the customs, language, religions, or caste affiliation, Indians live together relatively harmoniously. Family defined and extended is a source of support throughout life in India. Role and responsibilities are influenced by age and gender. Children are cherished and considered a gift from God, and they have full support from their families for their entire lives because of family progress, unity, and support is held in the highest regard for life. Pretty much, as you know, I have not as you know, but I I have Indian friends, or I know Indian friends. Their family is everything to them. It's the base of everything. With family, it's pretty much like if you have your family, you can go against anybody or against anything, like a protective shield. So, major health issues. India is a disease-ridden country. People suffer from serious diseases such as malaria and tuberculosis. One-third of the world's tuberculosis causes are in India. Also, polio, although eradicated in most of the world, is still prevalent in India. Although there has been a decrease in the incidence of diseases such as polio, leprosy, neonatal tetanus. In India, there has been a rise in drug-resistant fever, viral hepatitis, tuberculosis, malaria, and pneumonia. There's also an unusually high incidence of type 2 diabetes, also known as non-insulin dependent diabetes. That was back in 2001. I found a recent article on the top healthcare problems in India as of 2014, which are AIDS/HIV, typhoid, and hepatitis. Health disparities. 1/5 of maternal deaths and 1/4 of child deaths in the world occur in India. Also, India has one of the lowest life expectancies and high infant and child mortality rates in the world, according to WHO. There's also a rural-urban divide in India reflected by substantial rural-urban differentials in allocations of resources, the lack of available doctors and hospitals. I found an article from the International Herald Tribune. A gentleman talks about these two hospitals I have pictures of, which is Wockhardt and Boring. Wockhardt is a thriving hospital that has everything that you need and more. And it's in a very popular area. Meanwhile, Boring is ran down and they lack the tools that they need. And it's also in a city where they need health attention. And while Wockhardt has machines they also have rooms and machines and people that in some cases that they don't use. So while they feel that because Raquel has all this stuff, they should be able to take from them and be able to give it to Boring, so they can actually use it, put it to good use, because we know they know that India's health is lacking, and that could be put to use. That was pretty much where he was going with his article, which is a part of the health disparities there. And that is the end of my paper or my presentation. Thank you for watching.